Thank you so much, and good afternoon, everyone. And apologize for the being a bit delayed. And first of all, really conveying to you the greetings from our regional director, Imon Murphy, and also greeting from all the regional UNAIDS team based in Bangkok. So here is the title of the presentation as requested by the organizers. And let me, with no further ado, walk you through the presentation. This is an important meeting always to talk about the successes, important to recognize and celebrate those successes, but of course, challenges. We are facing also challenges in the region. And let me walk through the data story that will challenge us to rethink how we are of service to the people in AP region. So in that slide, you can see that Asia Pacific has the world's largest HIV epidemic outside Eastern and Southern Africa. In 2022, there were 6.5 million people living with HIV in the region, and there were 150,000 AIDS-related deaths in Asia Pacific that year, with 300,000 new infections. This is one new HIV infection every 2 minutes. You can also notice that the women accounted for about 1/3 of the HIV burden in the region, and there were 4.2 million people living with HIV receiving life-saving antiretroviral treatment in 2022. So this slide is really to simply show you where is our Asia-Pacific region standing in the global trend in terms of new HIV infection and AIDS-related death. You can see that the global average reduction in new infections is 38%. But if we take Africa and Europe out of the picture, what is left is a stagnating or deteriorating trend in AP region, with HIV epidemics primarily affecting key populations. And to achieve the global targets, Asia Pacific, with its huge populations, will be absolutely critical. So here we really want to show that the progress in HIV response is really diverse across countries in the region. Some countries are doing very well in controlling HIV epidemics and reducing AIDS-related deaths, but there are some countries seeing expanding epidemics with increased new HIV infections and AIDS-related deaths. You can see the Philippines on the right side of the slide with 418% increase in new infections between 2010 and 2022. We know that ending AIDS is possible, but we really need to address those inequalities in HIV response across the countries. So here it's really to show the spread of HIV among young people, which is a major issue in the Asia-Pacific region. And without going through all the blocks, really you can focus on the block at the back of the at the bottom, of the slide, where you can see that young people really account for 26% of total new infections in the region. And on the left side, you can see countries such as Myanmar, Indonesia, Thailand, and Philippines, where almost half of HIV infections are occurring among young people aged 15, 24 years. So we will really have to renew the efforts. And even in countries like Indonesia, Malaysia, and Vietnam, where new infections are declining, you can still see HIV prevalence among MSM, young MSM population increasing. Here, without going into the details, is just to remind us that AIDS is not over globally, neither in the region. And you can see the data regarding the young people, 15, 24 years old, the number of new infections, and per every hour, and also the number of AIDS-related illness every day. So, just to remind, and we are all aware of that, that HIV is heavily affecting key populations and their partners in the region. And you can see that 79%, almost 80% of new HIV infections occur among key population and their sexual partners. This is what you see on the left side of the slide. And on the right side, one of the reasons is really the punitive laws against key populations and people living with HIV. And you can see here some of the issues or behaviors that are criminalized. This slide is really also to share the findings from the Stigma Index 2.0 reports and behavioral surveys. And you can also see from different countries, Myanmar, Cambodia, or Malaysia, how human barriers and social justice are fundamental, because now because the slide show you that the key population avoid seeking for services because of those reasons. Here, just to show how we need to really scale up innovative interventions and DSD across the continuum of prevention and care cascade. Access to combination HIV prevention and treatment services among key population is really limited. It remains limited. There are additional efforts to renew. But definitely from the data that you see, you can see that less than 1/3 of MSM in reporting countries are served with combination HIV prevention services. We all know PrEP as a potential, which is a tool, a treatment tool and prevention tool, which has the potential to markedly lower new infections, but many countries across the region, across the world also need to pick up the pace, transitioning from pilot project to national rollout. And we would not see the expected payoff from investment in PrEP unless it is implemented to scale. And you can see the huge gap, 98% for Asia Pacific region to reach the 2025 PrEP target. So here we have just try to unpack the previous slide where we just talked about the PrEP service gap in the region. And as you can see clearly in the analysis, you can see that many countries with expanding epidemic or larger numbers of new HIV infections, here you have Philippines, Pakistan, Bangladesh, they are really lagging behind in scaling up PrEP. And if the region is to achieve the target, we need these countries, not only them, to really scale up PrEP for those people who are most in need of this effective HIV prevention tool. So, it's also important from this slide to understand that the region is really making good progress towards achieving HIV testing and treatment cascade targets, and a few words were said before me around those progress. And you can see that Asia Pacific region has achieved 78%, 65% and 62% against the 95, 90, 86 targets, However, it remains fall short of the global average. And you will remember that there were 4 million people living with HIV that achieve HIV viral suppression. That leaves about 2.5 million people living with HIV without HIV viral suppression. So this region needs to address inequalities in service provisions to close the gaps across the spectrum of treatment and care cascade in all population and all settings. So here it's really again to unpack the regional cumulative numbers presented in the previous slide and identify where the HIV service gaps are. And what this analysis shows us shows the HIV treatment cascades across the countries in the region by their epidemic pattern. And you can see really the glaring HIV service gaps among countries with expanding HIV epidemic and countries that have a big chunk of new HIV infections. And for example, if you look at the left side of the slide, 5 out of 6 countries with expanding epidemic have HIV treatment coverage lower than 50%. Here is really just to show that most of the HIV transmission in the region is occurring among key population and their sexual partner, but yet many of our countries are not investing enough to break the chain of transmission. You can see that it's less than 10% of total HIV expenditure for key populations HIV prevention programs. Here, really to remind you that the 30, 80, 60 targets the member states have committed to during the last high-level meeting on AIDS. And the Global AIDS Strategy highlights the key role of community-led HIV response, and the HIV response at global, regional, national, and subnational levels is ramping up to enforce the community-led response. And yet many countries are not ready to scale up community-led response. So this is really an urgent need to expand community-led responses and really ensure inclusive HIV and health governance as a central strategy of HIV response. And really, it's really important to have the communities at the center of the response. And without the communities, we won't be able to achieve the 2025 targets. Here, this is my last slide. I hope I remain in the allocated time. And it's really to highlight the game changers based on the successes and looking forward to the challenges ahead of HIV response in Asia-Pacific regions. We know that there are ambitious targets, the 10-10-10 that you know, related to the stigma, human rights, gender barriers, societal barriers. We have the 95s, we have the 30, 80, 60 targets regarding the community-led response that I just reminded a few minutes ago. And under the umbrella of these ambitious targets, we have 4 regional priorities of HIV response that will be implemented, are already implemented, but we need to renew the efforts, as I mentioned, utilizing 4 key principles: people-centered community-led response, public health approach, human rights, and innovations. My last point really is to just remind us that in the Asia-Pacific region, there are very diverse nations with very diverse epidemics. While Cambodia, Thailand, and Nepal are on track to achieve the 95 targets, there are epidemics of concern in Papua New Guinea, Philippines, as I show you. So AIDS is not over. There are countries being left behind, there are communities being left behind, and there are socioeconomic realities that can compound losses and compromise gains. So let's really continue the fight against HIV and AIDS. Thank you so much for your attention.